The Older People's Alcohols during Covid-19 project came about particularly, I think, through the work with our patient and public involvement contributors, who were kind of noticing amongst their peer networks that there were changes in the way that their peers were drinking, affected by the COVID pandemic. And it was something that we wanted to look at because we know that older adults are the age group that have the highest rates of harmful alcohol use and alcohol-related harm. So we really needed to be keeping track of what this group were doing and considering what their support needs could be moving forwards. I already had a relationship with people with lived experience through previous research and also work as an embedded researcher with an organisation called Drink Wise Age Well, which was operating across the United Kingdom after I'd finished my PhD in 2019, so just before the pandemic. This group particularly were also involved in advocacy work for the Drink Wise Age Well organisation, so they had a vested interest themselves in contributing to the research end of that and producing the evidence that's needed to inform changes in practice and policy. I'm
a recovering alcoholic and I've been in recovery for just over 10 years now. I was volunteering with the Drink Wise Age Well programme, and at the end of the programme I was asked to help disseminate the findings from the programme to frontline alcohol workers. So I helped deliver a range of workshops to those workers. At the same time, there was evaluation and research taking place in the programme, and Beth had been involved in some of the research. She'd seen people like myself, and particularly the people in Glasgow, who are colleagues of mine, working as experts with experience with frontline alcohol workers and others, and wanted to take it on board and use our expertise. And so I was invited effectively to help advise on some of the programmes.
I've struggled with alcohol for a long time, and I got involved with Drink Wise Age Well, which was an alcohol project for people over the age of 50. Which helped me get sober, and I got to know Beth. Beth was lovely, and she offered some work, and of course, you know, I've not worked for a long time, so I trusted Beth, which takes a lot of effort to trust somebody after struggling with issues with alcohol, and I took her up on the offer.
Beth had set up essentially a focus group of people who had really had diverse life experiences. She moulded us into a free-thinking group of diverse people who actually had the same common aim.
For this project, we were moving more towards a co-produced approach to research in the way that we were involving our patient and public contributors. So we'd always involved them in the design of the study, the design of the recruitment materials. I'd be moving towards involving them in the analysis of qualitative research as well.
Most of the time it's advising Beth and her team on what to expect when talking to older people with alcohol issues. We advise on the interview scripts, on how to assess and how to engage in people who will take part as participants in the research project, look at getting the right balance and where to get the people from.
When you've got lived life experience, it's just, you've been where these people are, and you can talk to them. They actually know where they've been. It really is, it's a massive difference.
Several of the members had roles as peer researchers within Drink Wise Age Well and their parent organisation With You, which meant that they had access to and permissions around the web chat service, which had material that was going to be useful for us to examine to understand the impact of the pandemic on older people's drinking. So Sarah, who was working as a peer support worker With You, took on that data extraction and data analysis element around that web chat platform.
I was lucky enough to be able to get into the web chats and look at all their analysis from the beginning of COVID and read through each and every one to find out what their issues were during COVID. Beth wanted to know whether I could pick out reasons, being somebody with lived experience of alcohol, pick out what their issues were.
Obviously, we had an established relationship with Drinkwise and with you, and we were able to get the ethical permissions from their medical director to be able to utilise that work.
I think it's easier with somebody with lived experience and struggled with alcohol for 40 years to actually look at these transcripts. And I would pick up things, well, she's drinking during COVID because obviously she's on her own, she's really struggling. And I mean, that's a simple one, there are harder ones as well, that Beth necessarily might not have known.
There was an element around it that we were expecting some accounts around mental health in terms of older adults' reasons for changing in their drinking during the pandemic, but it was something that I just wasn't picking up on in the interviews or in the transcripts.
Beth and the team are brilliant and they're absolutely excellent researchers. But they've not got lived experience like someone like myself, so they don't know some of the nuances that you get when talking to people with alcohol and mental health issues. And perhaps myself and other colleagues can pick up on those nuances and point Beth and her team in the right direction and to pick up patterns that are emerging that maybe they wouldn't be able to spot.
We had two of our peer research group, John and Jim, who came along to our end of project meeting with the key policy makers that we were engaging with for that research project. So our research was to inform what their policy decisions were in relation to our topic area, and that work was kind of facilitated by the policy research unit. And they really enhanced the policy makers' understanding of what our project findings were.
There's nothing beats having lived experience because you know you've lived that life and you know and you can feel when things are right or when maybe you need to probe a little more, say in an interview.
It's taken me a long time to be an expert by experience. And sometimes I don't see that I'm a confident person and I'm trustworthy to do things because I think I'm just going to do it wrong or make a fool of myself. So I think working on a project like this, when somebody has to trust in you to do something and says, so just give it a go. It doesn't matter if it's wrong, just try your best to do it. And somebody like Beth saying, you'll be better at it than me because you've had the experience. It just means so much. It's a lovely feeling to feel wanted and needed by somebody.
The peer researchers have greatly impacted on my research skills and my development. I think particularly around kind of that understanding of alcohol dependence and recovery and how to interact around those potentially stigmatised areas. This group have familiarised me with the particular issues around drinking in older age, the sensitivities around talking around that, and kind of how you engage with that kind of group.
By helping with this transcript, I realised that I was actually helping people. And I think that's one of the most important things for me, if I can help somebody else over problems with alcohol or point them in the right direction or help Beth do a report on something that proves that there was difficulties with people during COVID and I'm part of that, then makes me feel proud, makes me feel that after all those years of drinking, finally something good has happened to me and somebody trusts me to do something quite important again because I've not had that trust for a long time.
I had lived a lovely life and then I ended up in a very, very dark place, right? And then like a horribly dark place. And from there I had to recover again, and being a part of this project, it gave me a confidence in myself and in others I never ever had. And a belief that a diverse group of people can become just like a very special thing, like a very special unit in its own right. It's given me confidence and it's making me believe that I can contribute something else to society, which I know about and which I can help to, pass along.
Off the back of that COVID project, we recognised that mental health was something that was really affecting how the older age group were using alcohol, and particularly when they were increasing their drinking during the pandemic. And we've brought funding together to do a really in-depth co-produced project to understand the support needs of older adults who have co-occurring alcohol and mental health problems, and how these might be addressed in integrated services moving forwards. I just feel really fantastic that we're able to deliver on the research that's really needed, and that's something that they really played a key role in making happen.
One of the components that's been missing from a lot of not just research, but actually in the structuring and developing of services for people with alcohol and mental health issues, and for many other actual health issues as well, is that it's been something that's been done to people rather than that it's done with people. The days of when somebody from on high said something to you and that was it, and you just followed meekly along have gone. People need to be treated as individuals and as a whole, and they need to be able to have some sense of agency and control over their own health and the development and improvement in those health. And I'm very pleased to see that that is actually what's starting to happen in society.